back to my A to Z video series on topics to do with pregnancy and perinatal mental health. My name is Dr. Erin Bow and I'm a clinical and perinatal psychologist, and I also teach hypnobirthing in the Macedon Ranges in Victoria. Today we're up to the letter T, and I want to talk to you about the importance of touch before and during labour and after labour as well. Now, before you kind of think, oh, this sounds a bit like wishy-washy, what do you want about? There are really good psychophysiological research studies that show touch produces amazing endorphins. And I've talked about this in my video series a little bit before, but in hypnobirthing classes we kind of talk about three main types of touch. I won't go into them too much, but it's just to give you a bit of an idea. The first is light touch massage. So having your birth partner, your doula, your midwife, whoever's with you on the day of your birthing, just applying really gentle light strokes. Your skin is the biggest organ, of course, and you absorb and release an awful lot of hormones this way. So having just a light touch on your skin while you're labouring can help with things like reducing pain, making you feel calmer, and of course the big one is producing lots and lots of oxytocin. Same that having something like an anchor touch can be, and an anchor touch in hypnobirthing is really just it's a touch that might just be like having your partner like just touch your forearm a little bit, which you'll use as a deepener or a reminder to relax further, but also reassurance that you're there, you're not alone, and for whatever else you might want to use it for. So that's something we talk about more in classes. And of course the other one of my favourites, of course, is acupressure. So targeted pain management, I guess, if you like, which MRI studies show light up all these amazing parts of your brain to reduce tension and pain. Acupressure is an absolute essential for pregnancy and labour, if you ask me, and you can look into that a little bit more in some of my other videos, and links to resources that I've put in previous videos, which I'll link down here as well. So what's the point of all this touch? Really, it's getting into this oxytocin storage that I've talked about before. No matter what kind of birth you have, if you have a good store of oxytocin before your birth, it is going to make it just that bit more manageable, less stressful, and potentially less painful. So touch is a really good way to get oxytocin flowing. Now, whether that's you have your partner giving you massages, or you go and book in for massages, physio, getting your hair done, acupressure, acupuncture, all of those things where there's touch involved will really help build up those oxytocin stores, because of course on the day, the more oxytocin you have, as I said, the calmer you will be, the more sort of potentially chilled out your labour will be. But also things like helping with those uterine contractions after birth can just shrink everything down, and it means, you know, less likely to need other drugs or other interventions if that's not what you want to do. It also just makes you feel more calm, more alert, and helps you bond with your baby. Of course, that skin to skin immediately after birth is so important for mum and for baby. In terms of why it's important for baby though, apart from the obvious, the oxytocin that's produced through mum and dad to some extent helps keep a baby warm much better than a blanket ever could. So that's why it's important to keep your newborn as close to you as soon as possible, because it regulates their heart rate, but it also does amazing things like helps them feel more alert, helps them learn faster. Oxytocin is just, it's amazing for mum and for baby. So if you look at other research to do with other kinds of touch immediately postpartum, the sucking reflex, not only, I mean, does it help with bonding and attachment and initiating breastfeeding, but it does other things. Like there are about 19 different hormones, gastrointestinal hormones, that are released when a baby starts to suckle. So it's not just about the breastfeeding, it's also about those amazing hormones that are released that help with your baby's digestive tract and good gut bacteria. Same with when after your baby's born, you know, lots and lots of kisses is good, because the tiny little microbiomes on their hands and in their saliva help mum's body to just amazingly know how to adjust her breast milk just perfectly for her child. So you might have seen studies where if a baby's been sick, you can see sometimes that a mum's breast milk changes colour, and that's one of the indicators that, you know, your body is perfectly set up to provide exactly the type of nutrients, but also, I guess, illness relieving properties that babies need. So touch is just so important. Now, if you hate the idea of being touched, you've got issues with it, lots of labouring women do, that's totally fine. This is not saying you have to be touched if you don't want to. It's just something to try, something to have in your tool bag to get ready beforehand. And as I said, if you hate massage, it might be try something else like acupressure. If absolutely none of that floats your boat, don't use it. It's just a suggestion. If you want more information to do with these amazing beta endorphins, oxytocin, or just kind of good, you know, things to do in preparation for your labour and through the pregnancy and postpartum period, you can find more information in the videos I've done before, but also I'll link below relevant things, as I said, and you can find me at drerin.com.au. And I think that's about it for the letter T. We've got a few videos left in this series, but it's getting close, so thanks for persisting this far, and I will talk to you next time. Bye.